ADHD, ADD is not what you think. It might not actually be a disease, and the treatments we're using actually may not be working. This basically is a summary of a recent New York Times article that was published. It had 5 major points about ADD, ADHD, and I want to talk about that briefly because it's a big deal because lots of our kids currently are getting medications for something that actually might not be a diagnosis. So what's the point of this? Review the information, review the literature, using my clinical experience to help you all better formulate things you should be doing. Hopefully it help with your kids. And this is a part of our mini podcast series we do at the end of every week. We talk about a topic people have brought up to me, try and help you have deeper insights into these topics. If this is helpful, like, subscribe, share below. Also, if you have questions about it, please post them on social media below where we can answer them and get this to you. So I want to review this, and this is really important because this information coming out as of, I think, April 15th when I'm doing this, 2025, was when this article in the New York Times was published. And as we walk through it, you'll find out that this new information is actually not new information. It's stuff that's actually been known for a while. The first thing is that ADHD actually is not a disease, it's a condition. So what do I mean by that? What is this article? What does it mean by that? It means that, lots of different things can cause ADD and ADHD. Lack of sleep in kids, sleep apnea. Certain medications can actually cause symptoms of ADD, ADHD. Mental health conditions, anxiety and depression in kids can look like this. So one of the points of the New York Times summary article is that our understanding of ADD, ADHD is that it's currently, actually, it could be a lot of different things. And this is something we've known. I learned this in my training back 1996, 1998, that when you see a kid with this diagnosis, quote unquote, of ADD, ADHD, the very first thing you're supposed to do is rule out visual issues. If you have visual tracking problems, it can look like ADD, ADHD in a kid. Rule out depression, anxiety. Rule out other things like learning difficulties, processing things. If a kid has dyslexia, a kid has a processing issue, then all of a sudden it can look like they're inattentive, they have focusing issues when it's actually something else going on. This is not new. It's something we've known for a long time. But what's happened in our current society and culture of the focus on diagnosing things, we've basically taken something that's a compilation, a syndrome, given it a diagnosis, an ICD-10 code, a DSM-5 criteria, and the result is medicating lots of kids. But the point of this New York Times article is that the symptoms of ADD, ADHD vary, they come and go based on circumstances, situations, and different treatments are used for them. So it's not actually a quote unquote disease like you have pneumonia, take an antibiotic, you have heart failure, do this. It's a compilation of things. And again, that's old information. But I think we should remind ourselves that it's actually a syndrome, which means it's a compilation of symptoms that suggests something else is going on. We've just medically in our society decided to ignore the something else and just treat the symptoms. So the question becomes, have the treatments been working? That's the next top 5 things to reconsider. Another part of the article, this is a compilation of them looking at research and studies and putting it in one place, is that medication effects are temporary. Well, that's kind of the way the medications are supposed to work, because the medications we typically work can actually give kids anxiety, but also insomnia if they don't stop working. So the medication effects for the treatment are temporary. This might seem kind of, anecdotal or silly, but the point is when you treat a disease, you want the treatment to last. If you're treating symptoms or a syndrome, then the question is, what are you really truly treating? Because if the treatment is temporary, then we're not really getting to the root cause. And I think that's just the point, is that even the way our current healthcare system treats kids with ADHD, we kind of recognize that we're not really treating the root cause. We're treating, other kind of things. Now, one thing I've noted down this pathway, medications. What medications are currently FDA approved to treat ADD, ADHD? One's clonidine, as a patch, which is interesting because clonidine is an old school blood pressure medication. It actually blocks adrenaline, noradrenaline in your periphery. It doesn't get into the central nervous system. And when the result is it lowers your blood pressure. Well, for some reason, this actually treats ADD in kids. Well, it's interesting because I also use it with patients with POTS or dysautonomia. Some of my patients who actually have night terrors, you'll use prazosin, which is another type of alpha-1 agonist to actually treat night terrors. So what's probably happening with these kids is they actually have an underlying dysautonomia or imbalance in the nervous system that's being treated by clonidine. That's interesting. So let's get to the root cause of that and figure that out. Asking a bit much there. Another medication FDA approved to treat ADD, ADHD is Vyarion. What is Vyarion? It's a prescription DHA or omega-3. So maybe do these kids have an omega-3 deficiency that we're treating with this prescription drug. And that goes down to a whole other, I remember when I was on a mission trip in Guatemala and we were actually working on a school and getting a school for kids, And these are kids that basically didn't have access to education. They weren't doing really well. They're doing horrible in school. Well, come to find out, the kids were coming to school, didn't have food. They had like some coffee. That's all they had eaten. Usually that they wouldn't eat for like once a day. And all of a sudden, part of this school education program with this mission project was the kids need to get some food. Start the day with some food. The idea that what you eat and put in your body can affect mental function, cognition, attention, ability to learn is not a new concept. But there's drugs for it, which is kind of interesting. There's other medications you can use, second-line drugs like SSRIs, amoxicillin, which is another prescription actually FDA approved for ADD, ADHD, is a mixed epinephrine, norepinephrine medication approved for ADD, ADHD. So are we treating underlying anxiety or depression? These medications also have lower cortisol a little bit and are anti-inflammatory. So again, interesting. What is the cause of ADD, ADHD? And then the medications, the standard ones that most kids respond to, which are your stimulants, Adderall, et cetera, which only work for maybe half the day. They have a lot of side effects. But the point is, just the FDA-approved medications tells us right there something else is under the hood. And this article kind of addresses that. But then all these side effects from medications, when you use the stimulants, you can actually suppress the growth of kids. They can become stunted. Well, you suppress their appetite. Strangely enough, Vyvanse, one of the medications for treating ADHD, is also approved to treat binge eating disorder. So there's something else under the hood. Don't want to go into that because that's another conversation. But the point is that the medications have side effects and other things going on. There's also some interesting data that using long-term stimulants can increase your risk for cardiovascular disease. And there's some older literature, and it's looking for people using really high doses for longer periods of time, a question of Parkinson's or neurological issues. And we give this stuff out like candy as if it has no side effects. Again, this is a April 2025 New York Times summary article talking about these things. And the last part they want to talk about is the diagnosis and treatment are becoming under scrutiny. Again, that's not really a new concept, but it's becoming new. Like maybe ADD, ADHD is something else. Well, just thinking about treatment options, thinking about all the things you have to rule out. There's an interesting book, The Anxious Generation by Jonathan Haidt. And it talks about anxiety. It talks about learning. It talks about kids' brain development. And actually talks a lot about social media, screens, technology. That's something we're actually dealing with our son right now in his school for kids with special needs. They actually put screens in front of all the kids. And you kind of wonder why the kids get crazy and squirrely when they get home, when they take their stimulant. It's interesting, some of the behavior of kids with screens. You experiment for all the parents at home. Take your 3 or 4 year old, give them a screen or iPad, play video games, whatever, for 3 or 4 hours. Take it away. What behaviors do you notice? You'll see a lot of withdrawal behaviors, emotional regulation problems, outbursts of anger, crying, emotional discontent. And if you give them screens in the afternoon, you see sleep disturbances. My son, this is anecdotal, if he gets screens a bunch and take it away, he actually gets kind of depressed. That's kind of interesting. What else might be going on with this diagnosis we call ADD, ADHD? Are medications the best way to address it? Could this be partially environmental? Could this be partially food? Like I kind of briefly talked about. The answer is yes. And the point of the New York Times article, which is something we've been talking about in the functional medicine world for decades, is particularly with mental health issues, particularly in kids, look for the other things under the hood. Jumping right to medications may and many times not be the best treatment. And one thing that was interesting about the article that it brought out, that again, for clinicians working with these kids, it's common knowledge, is that the medications primarily control behavior. So we're treating kids with stimulants just to control behavior. Won't go into that right now, but that's another, can of worms right there. So hopefully this information was helpful. It's not new research, it's just new information coming to public consciousness. And I feel like over the next year or two, a lot of this is going to be happening as we rethink about our food systems, as we rethink about medications, as we rethink about environmental toxins and chemicals. Things that are commonly thought of routinely in the functional medicine world now are actually coming to public knowledge, so that could be helpful. But hopefully this becomes a discussion about what's best for our kids. Not what's best for, simplicity, what's best behavior, but what's best for our kids to become good citizens, good persons, good humans, people you want to actually be proud to be your kids when they're growing up. And I think we've lost sight of that with just controlling behavior. What are your thoughts about this? Please post them below. If this information is helpful, like, share, subscribe. And if you have a question or something you've read, you'd like me to do one of these little 10-minute deep dives, and drop it below and we'll put it into the kitty and get to it if time permits. Take care and we'll talk to everybody soon.